pressure or anything like that, then the nurses will come give you the medicine in your tongue. They'll get an EKG, and but I think we have you on the schedule for the catheterization procedure, but it really just depends on when it can happen. Let me think. Yeah. So, are you dying from starvation right now? Really hungry?
Well, I'm a little hungry.
Hungry.
Yeah.
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 You haven't had anything since yesterday, huh?
Yes, sir.
Okay. So what I'm going to do, I'll go down. I think it's pretty unlikely it's going to happen today. It's a pretty busy day, and it really just depends on the list. And last I checked, we wanted to keep you. Sometimes there's a long list of people, and then sometimes there are cancellations, or you can't do it right now, or whatever, and so we shoved people in. So that's kind of why we asked you not to eat, just in case we could, because right now you're kind of you just came in, so you're at the bottom. But maybe we could squeeze you up if something changed. So let me go check right now. If it really doesn't look like it's going to happen today, we'll tell the team so you can eat, and then we'll try again for tomorrow.
Okay, doctor.
It's kind of, unfortunately, it's just limited by the number of rooms we have and the number of cases we can do each day. But as I said, given that you're getting all the medicines that should be helping this regardless, so as long as you don't have repeat episodes of chest pain, then I think it'll be fine to do it tomorrow or whenever we are able to do it.
So tomorrow, it's not for sure tomorrow.
Well, this is an acute care hospital, so we go by priority essentially.
Okay.
So if you overnight, God forbid, but if you happen to have a whole lot more chest pain and your numbers are going up again, then we'll we rush it down there. But that's the case for everybody. So right now there's just a list, and if someone else heats up, it's acute. You know what I mean? There's no.
So when people have heart attacks, they have to have surgery, or put him on pills and things like that. Could it get better, or he has to have surgery because something's going on?
So I'll say this actually isn't surgery; it's just a procedure.
Okay.
So we're not going to be using knives and stuff like that. All we're going to be doing is using catheters and like a needle to put the catheter in. It's just a procedure. The answer to your question is no. If people have small heart attacks, they don't necessarily have to get this procedure, catheterization. In fact, before this was invented, all we did was medicines. That's all we could do. But generally speaking, if we're fairly convinced that there probably is a blockage, and we can get hints of that based on how high the numbers go and stuff like that, then the sort of the standard of care, if it's available, is to do this procedure, see how the heart arteries look, and if any of them are significantly blocked, we can use a stent and a balloon to open up that artery and keep it open, basically. Because the problem is if it's 90% blocked now, if we don't put in a stent, there's a higher risk in the future that it could block up again.
Okay.
The body actually does a pretty good job of breaking down the blockage, but we can help it out with the medicines, and we can help it out with the stent when they need it. But the stent is not actually the answer. So at the very end of the day, the best thing we can do for you is to get you on the right medicines, the right pills: aspirin, metoprolol, which is a beta blocker, a statin. You guys have probably heard a lot about statins in the news, a cholesterol medication. Those are the three main pillars of how we try to prevent this disease, this blockages, from getting worse 10 years down the line. Stents don't do that. Stents, it's like plumbing. You open up your drain pipe with the stent, for example, but 5 years later, if the same processes are happening, you'll fill it up again. You know what I mean? So stents are not the answer. It just helps in the acute setting. If it's really, really narrow, then you can open it up.
Okay.
But the medicines, the ones I mentioned, which we'll get you on and send you out with, those are the ones that are really going to help you in the long run. Plus, of course, changing your diet, or limiting, cholesterol, fatty foods, increasing your exercise as much as you can, stuff like that.
Okay, doctor.
And the clogged arteries, you guys don't see that until you actually go in there?
That's correct. We can't know for sure until we actually use the catheter and use X-rays to see which ones are blocked. But based on the numbers that you had, at the other hospital, my guess would be we're going to see some blockages.
Okay. I like the word procedure.
Yeah. No, it's
I
just a
like that one.
procedure. It's actually very,
That's a good one.
very straightforward. You know, it's we do it very frequently.
Okay.
I might be back. Either me or someone else will be back to chat with you a little bit more about the details of the procedure. Actually, why don't I just do it now? Let's just do it.
Okay.
It'll help everybody.
Okay.
So, as I said, we're going to take a catheter smaller than that IV line, okay,
Mhm.
and put it into an artery, either in your wrist or into your groin.
Okay.
We move it up around the heart, and then we use X-rays, and then we use contrast dye as well. So we shoot the contrast dye into the arteries in your heart and X-rays to visualize everything, and that way we can see if any of the arteries are blocked.
Oh, okay.
Okay, there's 3 main arteries, 2 on the left, 1 on the right, and we'll be able to see visually how narrow they look based on blockages. If something is significantly narrowed, and usually that means more than 70%, when we see that, we can use a balloon and put in a stent to try to open that up acutely. But we really don't do it if it's less than that, if it's 50% blocked, we really just put you on those medicines I talked about.
Oh, okay.
And the reason is that the stents are good; they can help you acutely. But in the longer run, they can also, it's metal in the body, it's a foreign object, it can clot off on its own. So if we were to give you a stent, you'd have to take 2 medicines, aspirin and Plavix, for at minimum 1 year without missing a single dose, because if you do, there's a risk that thing could clot. But we'll talk to you about that if we get there.
Okay.
Okay. The whole procedure takes about half an hour if we just look. But if we put in a stent, it may take an hour or so, something like that.
Okay.
What questions do you have about the procedure? We can give you some medicine to make you sleepy. As I said, the catheter goes either into the wrist or into the groin. The risks of the procedure include bleeding, some pain, although we give you numbing medicine, so that pain should not really be an issue. And then anything the catheter gets near could get damaged. So the blood vessels that lead to the heart muscle, the heart valves, the heart arteries could theoretically get damaged. We're putting a plastic catheter up in there. But generally speaking, we see where we're going with the X-ray, and it's very safe. I mean, we do this very frequently.
Okay.
But you have to understand that any of those complications could theoretically happen. Yeah.
And the recovery time is?
If we go through the groin, you have to lie flat for about 4 hours. And then after that, we just ask for no heavy lifting and no submerged bathing, like in a pool or in a tub, for 1 week. That's pretty much it. If you go on the wrist, you don't even have to lie flat, and just again, no heavy lifting for 1 week. So it's really it's just a fairly straightforward procedure. Yeah.
Yeah. Mhm.
Any questions?
No.
Do you have any surgeries planned coming up? Or
No.
anything? No? Okay.
No.
And I ask that because, again, if we put in a stent that needs the aspirin and Plavix every day for a year, you have a planned big surgery in a month, then we have to talk about putting some other kind of stent in, because the surgeons will not operate on those 2 medicines. Increases your risk of bleeding. It thins the blood, prevents the clots from happening.
Oh, okay. No, I don't.
Okay.
No.
Okay. Let me get the computer to have you say that you understand the procedure, and then we talked about it.
Okay.
And I'll just take a quick listen to you.
Okay. Okay.
All right.
Doctor. Okay, doctor. Thank you.
Sure.
Okay.